Hi, my name is Karen. I'm one of a team of physiotherapists working on the surgical units at Markham Stouffville Hospital. In this video today, I'm going to review with you some things you can do to prepare for your surgery, including exercise program. I'm going to talk to you about what's going to be happening when you're in the hospital, what to expect from the physiotherapy team, and then also planning for your discharge home and continuing with your physiotherapy as an outpatient. Before I go over the exercise program, there are some images demonstrating a total knee replacement and a total hip replacement. If you'd like more information about your particular surgery, there are numerous resources available online. If you find that you still have more questions, feel free to call the nurse navigator or talk to your surgeon. These are some images of x-rays of a total hip replacement and also an image showing both a partial knee replacement and a full total knee replacement. If you're interested in knowing more about your x-rays, the best opportunity to see these is when you come to the fracture clinic for your follow-up appointment after your surgery. Talk to your surgeon if you're interested. What can you do now to prepare for your surgery? In a few moments, I'm going to go over an exercise program that you can do prior to surgery, and the same exercise will be completed after the surgery. There are two benefits to doing the exercise program prior to your surgery. One benefit is that you will know the exercises. You'll have had an opportunity to practice them, to read through them, to get familiar with them, and to know how to do them properly. We find it much easier when patients have already practiced the exercise prior to their surgery, rather than trying to learn something new when so many other things are new and unusual in your environment. The second benefit of doing exercises prior to your surgery is that hopefully you will improve strength and flexibility of your affected joint. But be mindful that you do have arthritis in your joint. The exercises may be difficult or cause discomfort. Please do them carefully, do them cautiously, nothing forceful, and just do your best. If you find that you can't perform the exercise on your affected hip or knee, then practice on the other side. The most important thing is to learn how to do the exercises properly and to feel comfortable with doing them. We are going to ask that you do these exercises once a day, every day from now until you have your surgery. If you find these exercises are challenging or you feel that your strength is low, you can do the exercises twice a day until your surgery. We recommend doing 10 times each if you're able to. Please do not do them forcefully. Please do not increase your pain, and be careful with these exercises. After the operation, we'll be asking you to do the exercises 3 times a day, every day, until you have your follow-up with your physiotherapist in the community. You will be continuing on with those and other exercises after that time. The first exercise you're going to do is what we call ankle pumping. It's a very simple exercise, and you're going to be pulling your toes up and pointing your toes away. Pulling your toes up, pointing your toes away. You need to do this in a rhythmic fashion. We do not want you to be doing it quickly. We want slow, full movements to encourage circulation into your lower extremities and to prevent a blood clot. You're going to be asked to do this exercise 10 times in a row, every hour during the day that you're awake. So again, point, pulling up, pointing, pulling up. This can be done in lying. This can also be done in sitting. And we do recommend doing both feet together at the same time. So the next exercise is going to be contraction of your bum muscles. So you're going to be tightening your muscles of your bum cheeks together and holding, counting to 5, and then relaxing. You're going to do this position more lying down so that it's more similar to a standing position. So I'll lay a little bit back and just imagine tightening your bottom cheeks together, hold 2, 3, 4, 5, and then relaxing. And one more time, tighten your bum cheeks together, 2, 3, 4, 5, and then letting go. The next exercise, you're going to be tightening the muscles in the front of your hip so that you're pressing your knees down into the bed. So imagine there is something underneath your knees, and you're going to be pushing your knees down into the bed, holding 2, 3, 4, 5, and letting it relax. You should be pulling your toes up as you do this. So again, pushing your knees downward, holding 2, 3, 4, 5, and then relax. And one more time, pushing downward, toes coming upward, tightening the front of your thighs, count to 5 slowly, and then let it relax. Those two exercises are not doing a lot of movement at your hip joint, so they should be quite comfortable to do before the surgery and after the surgery. Now we're going to do some exercises where you're going to actually moving your hip joint, so please be cautious, start them gently, and progress as you're able. Okay, the first exercise, you're going to be bending your hip and your knee, so you're going to be taking the sore leg or the affected side, you're going to slide your heel along the bed, bringing it up toward your buttock as far as you can comfortably go, holding and slowly lowering back down. Again, you're going to slide your heel along the bed, coming towards your buttock, and you can be in a little bit more of a laying position when you're doing this. Hold 2, 3, 4, 5, and then lowering slowly back down. Now, before the operation, you may have a lot of difficulty with this exercise, so please start cautiously. To make it a bit easier, you can place a plastic bag under your heel, which reduces the friction and will make the movement easier to complete. I do not want to do any bouncing. There should be no pulling. It should be a gentle, smooth movement, coming up as far as you can comfortably go, and then again, lowering slowly back down to the bed. Okay, the next exercise, I'm going to need you to create some kind of roll that you can use at home for the next exercise. So in the hospital, we take towels and roll them up like this, tape them together. At home, you can use a paper towel roll wrapped with a towel. You can use an apple juice can wrapped with a towel or a blanket. Some people will use pool noodles, again, wrapped. You want to make sure that it's firm and about a 6-inch diameter when you've made it, and then you can put just elastic bands or some tape around it to hold it in place. So for this exercise, I'm going to place this underneath my knee so that my knee is resting on the roll. With this exercise, what I'm going to be doing is I'm going to be lifting my lower leg up to make my leg straight. Make sure that you're not lifting your leg off of the roll. You actually should be pressing down into the roll, pulling your toe up and lifting up, making your leg as straight as possible, holding to count of 5, 1, 2, 3, 4, 5, and slowly lowering back down. So again, pull your toes up, push your knee down into the roll, straighten your leg as much as possible, hold 2, 3, 4, 5, and lower. Now the last exercise is going to be laying in the bed. It's going to be bringing your leg out to the side. Now I will say in advance that some people after their hip replacement surgery will not be permitted to do this exercise for a period of time after your surgery. If that's your case, we will let you know in the hospital and we'll make sure that you're fully aware of what your limitations are. But before the surgery, everyone is allowed to do this particular exercise. So the idea of this exercise is you're going to be bringing your leg out to the side, bringing it back to the center. Now, many of you will have concerns with this movement before the operation because this is usually very uncomfortable for you to do. So again, go gently, be cautious. Don't do anything forceful, nothing bouncing, and try to gently do the exercise. If you practice it each day, you hopefully will find that you're able to go a little bit further, increase the movement, and find it more comfortable so that you'll be able to do the exercise more easily. If you're having difficulty with this exercise, again, you can place the plastic bag under your heel, in which case, again, it reduces the friction, makes it a little bit easier for you to bring your leg out to the side and bring it back in. Now, normal movement with this activity is about out to here and coming back. So please don't expect that you're bringing your legs really out wide like doing the splits. Just want to mention that when you bring your leg out to the side, keep your toe pointed to the ceiling. Avoid any turning outward or inward of your foot so that you're gently sliding out and gently sliding back in. Okay. The first exercise you're going to be doing is what we call ankle pumping. And so you're going to be pointing and pulling your feet up and down. So pointing your toes away, pulling up towards your nose, and repeating in a rhythmical fashion. We do not want you to be doing it quickly. We want a nice, slow, but regular movement so that you're improving the circulation to your legs and helping to prevent a blood clot. We're going to ask you to do this exercise 10 times in a row every hour of the day when you're awake. This exercise is quite easy to perform, so you should find that you're able to comfortably do this exercise before and after the operation. The next exercise we're going to do is pressing your knee downward into the bed. So imagine that there's something under your knee and you're pushing your knee downward into the bed to tighten the muscles on the front of your thigh. You're going to hold 2, 3, 4, 5 and let it go. Now, when you do this exercise, we do want you to pull your toes upward. You may feel some tightness at the back of your knee, and then you're going to be pushing your knees down into the bed and holding 2, 3, 4, 5. When you're doing this exercise, you're going to be strengthening the muscle in the front of your knee, but also stretching those muscles that are probably very tight at the back of your knee. The next exercise, we're going to need you to find something that you can use at home. That's going to be a strap type of product that you can use to help with the bending and the movement of your leg. So in the hospital, we use a single sheet. You're going to put it around your foot. I don't recommend anything larger than a single sheet, as you'll find it's too thick and bulky. Other suggestions are a sash, a scarf, the robe, a belt from your robe, also a luggage strap, or another option is a duffel bag strap. You don't want anything elastic like TheraBand or elastic band. You don't want it to have any stretch. You want it to be solid. So usually the best thing at home is some kind of longer belt or sash. And again, you can try using a sheet, but keep it to a single sheet. So the first exercise you're going to do with this sheet, you're going to be bending your knee. So you're going to be sliding your foot along the bed and bringing your foot towards your buttock, holding 2, 3, 4, 5, and lowering slowly down. Now, before the operation, you want to do this gently. You may find that this movement creates some discomfort for you. So don't yank on your arms. Keep the movement smooth. We don't want any shaking or pulling like that. But after the surgery, this exercise is going to be quite difficult to do. So you're going to be very gently pulling, sliding that heel along the bed, and our goal is to try to get that knee to bend as much as possible. You're going to go as far as you can, hold 2, 3, 4, 5, and then lowering back down slowly. You want to make sure that the strap is secure under your foot. Make sure that your heel is sliding on the bed and that you're not being aggressive or pulling at any time. And lowering back down. And just be ready. Sometimes going down can be as sore as going up. So gently come up as comfortable as far as you feel you can go. And hopefully over time, you'll find that you can get further and further bend in your knee. And lowering back down. Now we are going to use this strap for our next exercise as well. And this exercise is going to be to stretch the back of your leg. So you're going to be doing similar to the exercise we did a couple exercises ago where you pushed your knee down into the bed. So you're going to push downward. You're going to bring your toes upward towards you. But I'm going to use the strap and pull my foot towards my body. Now, it's very important that your knee stays pressed down into the bed. So for many of you before the operation, you're going to find you're going to try to pull here and your knee will pop up. So think of pushing your knee down and gently pulling your toes upward. Don't force this, as you might find all you do is bend your knee. This will likely be also very uncomfortable before the operation because you should have some tight muscles in the back of your knee. So for the next exercise, I need you to make a roll at home that you can use for this exercise. So in the hospital, we take a few towels and we roll them together and then tape them up. And it's going to be placed under your knee. At home, you can use a paper towel roll wrapped with some blankets or towels, an apple juice can wrapped with some towels, maybe a pool noodle, again, wrapped. But you want to make sure that it's firm and that it's about 6 inches in diameter. And this roll is going to go underneath your knee. So you're going to place it underneath your knee, and your leg is going to relax on the roll. So you're not actually lifting up at all off the roll. You're going to be pressing downward, and at the same time, you're going to be lifting your lower leg upward. So imagine pushing down. You're going to pull your toes up towards your body, and then you're going to be lifting your foot up so that you make your leg straight. Hold 2, 3, 4, 5, and letting it go. Now, before the operation, you may have a difficult time getting your leg completely straight. So just do your best. If you find there's a little bit of a bend, that's fine. Keep working at it every day and hopefully you can get to the point where you can get your leg straight. After the operation, though, our goal will be to have that leg straight and get that muscle really strong again. The last exercise in the bed is what we call a straight leg raise. So yes, you're going to be lifting your leg up straight off of the bed. You do want to be laying a little bit more back, laying down on the bed for this. And your goal is to be lifting your leg completely straight and up off of the bed. So what you need to do to prepare is push your knee down into the bed, pull your toes up towards your body, and then try to lift that leg straight up. Hold 2, 3, 4, 5, and lower back down slowly. Now, before the operation, you may have a bit of discomfort because of the tightening around your knee muscle and your kneecap. So just be careful when you first do this. After the operation, this is very challenging to do, but we will guide you in the hospital and give you some suggestions along the way. Final 2 exercises are going to be completed sitting in a chair. The first seated exercise, I want you to make sure that you're sitting in a firm chair and that your buttocks are all the way back into the chair. So your back is well supported and you're in a nice upright position. With this exercise, you're going to be straightening your leg and you're going to pull your toes up towards your body to try to make your leg as straight as possible. When you're doing this, you're going to be tightening the muscles on the top of your thigh, but also getting a very big stretch on the back of your leg. So you're going to be lifting your toes up, straightening your leg, and trying to get your leg as straight as possible. Hold 2, 3, 4, 5, and lower slowly. The second exercise is in sitting. You're going to be bending your leg underneath the chair. So you may need to move to the edge of the chair to complete this exercise, especially if you're on the shorter side. What you're going to be doing is you're going to be bringing your leg back underneath you, trying to bend your knee, and then bring your leg back out to the starting position. When you're doing this exercise, you're going to be using your hamstring muscles. So you're going to be strengthening your hamstring muscles, but you're also going to be stretching the front of your hip and the front of your knee. This exercise may not be challenging prior to the surgery, but it will certainly be more difficult, a little more challenging for you to do after the surgery. Most of you will be staying overnight in the hospital for 1 night. We do have some patients that have this surgery and go home on the same day. I'm going to go through what to expect in the hospital. If you're going to be having your surgery and going home on the same day, everything that I mentioned will also be done, but it will just be done all on the same day as your surgery. Most of you will be seen by a physiotherapist on the same day as your surgery. This may depend on the timing of your surgery and the time that you return to the surgical ward. At that time, the physiotherapist will come and see you, introduce themselves, talk to you a little bit about your home situation, your physiotherapy plan after the operation, and they will also test your movement and your sensation. If everything is going well at that time, the physiotherapist will sit you up on the side of the bed, try to stand you up at the side of the bed, and do some marching on the spot, and hopefully even do some walking in the room. Sometimes people are even able to walk to the bathroom. If the physiotherapist is unable to see you on the same day of the surgery, the nurse will be able to help you up to the side of the bed, maybe up to the commode, or even possibly walking to the bathroom. Our goal is to have you up, sitting, standing, and hopefully doing some walking on the same day as your surgery. The morning after your surgery, a rehab assistant will come and see you fairly early in the morning. At that time, the rehab assistant will go through all of the exercises with you that I've demonstrated today. They will make sure that you understand how to do them properly, that you're able to do them safely, and that any questions that you have are answered. This will be your one opportunity to review the exercises with a member of our staff before you're discharged home. After the exercises are completed, a physiotherapist will come to see you. The physiotherapist will take you for a longer walk outside the room into the hallway and give you some advice about your walking pattern and how to use the walker. After that, the physiotherapist will take you to the therapy room to practice stair climbing. We will try to simulate the stairs that you have at home, For example, if you have one handrail and 3 steps, we will practice that. If you do not have a handrail, we'll practice the stairs without a handrail. You will find that stairs are not as challenging as you might think. Most people are able to complete a flight of stairs the day they go home from hospital. Most people will not need to have their bed moved to the lower level, but you will need someone to be assisting you when you're on the stairs. After you've done the stair climbing, the physiotherapist will talk to you about how to get in and out of your car. Again, we'll try to simulate this car that you have at home, whether you have a truck, an SUV, or more of a car. Generally, a medium height car would be preferred. We're going to recommend that you sit in the passenger seat on the front of the car, move the seat all the way back, and you may need some assistance to get in and out of the car. Finally, the physiotherapist will go through everything that you need to know for going home. They will talk about your exercise program, how often, how many. They will talk about walking program, transferring in and out of bed, getting in and out of the car. They will talk to you about stair use. They'll talk to you about icing your joint, and any other questions that you have, they will answer. By the time you're leaving the hospital, you should be able to get in and out of bed on your own. You should be able to walk with a walker on your own. And you should be able to climb 4 or more stairs with one person assisting you. After you're discharged home, the physiotherapist will recommend that you continue the exercise program 3 times a day, every day, 10 times each. They will also encourage you to walk regularly during the day, ice your affected joint every 2 hours for 20 minutes, and be patient. This will take some time. Even though you'll be able to walk on your own with the walker when you go home, we strongly recommend that you have support when you go home. You will find it difficult to complete your exercises, do your icing, manage your medications, and get all the rest that you need at the same time as managing other things in the house. So having someone to help you with meals, help with cleaning, maybe laundry, and certainly it's very helpful to have a cheerleader, someone who can encourage and observe when you're doing your exercise program. We all know that someone watching you when you're exercising will give you a better performance. Everyone will need a 2-wheeled walker. So this is a walker that has 2 wheels at the front and no wheels at the back. They are aluminum, generally silver in color like you see in the video, but sometimes they are blue or red in color. They do not have brakes, they do not have a seat, and they only have 2 wheels. We recommend that you use this walker when you first go home. You may need that for 1 or 2 weeks, at which point then you may progress either to a cane, or if you have a 4-wheeled walker at home, you may progress to that at that time. The 2-wheel walkers come with either glides or skis on the back of the walker. This will make the performance of the walker a bit smoother on hardwood floors and on carpeting. 2-wheel walkers can be rented, borrowed, or purchased. We have included a list of vendors where you're able to rent or purchase these walkers. Please keep in mind that even though the walkers are adjustable, they still come in 2 sizes, generally a junior size and an adult size. So the junior size generally fits to about 5'4", 5'5". The adult size would be that height and taller. If you borrow a walker, please keep in mind the height of the person that you're borrowing the walker from compared to your own height. We do want that walker brought to the hospital, so you'll need to bring the walker with you when you come for surgery. Once you're up on the unit, the physiotherapist will adjust the walker properly for your height. The next piece of equipment that you will require is a cane. You will need a cane the day you go home if you are going to be climbing stairs. If you live in a condo or an apartment where you don't have stairs, you will not need a cane until approximately 1 week after your surgery. There are various types of canes as seen in the video. The main difference between the canes is the handle. So some are foam, some are solid, some are round, some are flat. It really is a personal preference or comfort in your hand. If you don't own a cane, certainly take the time now to go and find a cane that feels comfortable for you because you may be using it for 1 to 2 months after your operation. Please do not bring the cane to the hospital. We do have canes that we will use here on the stairs. Do have your cane available so when you go home and you have steps into your home that you'll be able to access the cane. If you're having a knee replacement, you will need a system for icing your knee. Pictured in the video is a Coreflex wrap that the hospital has available for purchase. This wrap comes with 4 gel packs, plus the wrap that you see on the screen that has Velcro so that it will fit snugly and properly around your knee. The use of simple ice packs will not be sufficient because you need compression as well as the cooling of the ice. If you wish to purchase a Coreflex wrap from the hospital, you can notify the nurses when you come in for your surgery. If you do not wish to purchase a wrap from the hospital, please bring your own ice system with you to the hospital. We strongly recommend that you have some system for wrapping the ice packs around your knee for maximum coolness and compression. If you would like to use an ice machine for cooling or icing of your knee after surgery, those are also acceptable. Finally, I would like to talk about outpatient physiotherapy. After you're discharged home, you will be following the instructions of your physiotherapist until you start your outpatient physiotherapy program. Following total knee replacement, you should expect your outpatient physiotherapy to start 1 week after your surgery. Following total hip replacement, you should expect your outpatient physiotherapy to start 2 weeks after your surgery. You will continue with the exercise program as outlined by your physiotherapist in the hospital until you start your physiotherapy in the community. At that point, then you will carry on as they recommend. We have a bundled care program for outpatient physiotherapy in the community. The nurse navigator has already spoken about that, and you will be provided with lists of clinics that are available in areas near you. If you have further questions, you can call the nurse navigator to clarify. We will make sure that arrangements are made prior to your discharge from hospital, as it is very important that your physiotherapy is continued after you leave the hospital. The physiotherapist in the hospital and the nurse navigator will help you determine what is best for your needs.